Discover the only way your practice will survive in the accountable care age. You're about to see how independent ODs beat declining reimbursements, guarantee higher profits, and are setting up to profit from accountable care. Are you ready for the accountable care age? Now, most ODs don't even really know what that means, and in the next few minutes, you will. You're going to get the in-your-face, unfiltered, sometimes sad truth about three things. One, the state of the United States healthcare system. Two, the fate of independent optometry. And three, our only hope for surviving the accountable care age. So welcome, I'm Dr. Vincent Calderon. I'm a founding board member of the New York IPA, and I'm in private practice in the Bronx, New York. The NYIPA board and I have sought out experts in public health, accountable care organizations, health insurance policy, and risk management to bring you the hardcore, uncomfortable facts that are facing our healthcare system. Now, the past does not equal our future. We're at an impasse right now in our profession, and what your actions are right now will determine how or even if you practice optometry in the next 3 to 5 years, depending on where you are in your professional life. So, this is the state of the United States healthcare system. We spend a lot on healthcare, 2.5 times more than the closest country. It's roughly 2.1 trillion with a T dollars. It's about 16% of our GDP, and I like to call it enough money to give every single man, woman, and child in our country about $6,774 a year for their healthcare costs. Now, some may say, okay, so the U.S. spends a lot of money on healthcare. That just means people have to start paying more money for their health insurance, right? Well, wrong. Because the average annual premium for households enrolled in health insurance as of 2009 is $13,375 a year. And it's expected to get to $24,000 a year by 2019. That's just unsustainable, man, because 70% of families make less than $60,000 a year with an average of only $51,000 a year. So that same study 3 years later was dead on target. Roughly $1 out of $3 earned is spent on premiums. That's $15,745 of annual total contribution. That's nuts. But wait, there's more. This is the average U.S. tax income in comparison to the 3 major entitlement programs that we promise our loyal tax-paying citizens. At this rate, in 36 years from now, the cost for Medicare, Medicaid, and Social Security will bankrupt our system. Change is coming. So some might say, well, that's just the price we have to pay for such great health care that we get in America. Well, not so much. Here's a comparison of America to 8 other developed countries. And as you can see, we have the lowest life expectancy. We're down here. We have the highest rate of infant deaths right up here. And we have the highest adult mortality. So it appears that just living in America is bad for your health. So the main takeaways here, our healthcare system is broken and growing broke. Nothing can stop it from changing how we practice. You scared yet? Don't worry, you will be, because now we're going to talk about understanding the Affordable Care Act. It was signed into law March 2010, and it's rolling out right now in 2014. It has 2 main objectives. One is to increase access to care for 30, which was later changed to 20 million uninsured. As of 2012, 47 to 50 million non-elderly are uninsured, which is roughly 1 of every 5 people you see walking around the street, and that's at an all-time high. The other thing that it's trying to do is control costs and restructure the healthcare system. So now let's think about this for a second. How can we provide better care at a lower cost to more people? Ta-da! 2 new healthcare models to save the day. Accountable care organizations and patient-centered medical homes. But what is an ACO? You may have heard a lot about it, but what is it? Basically, it's an organization of healthcare providers that agrees to be accountable for the quality, cost, and overall care of beneficiaries who are enrolled in the traditional fee-for-service program. This is one of the definitions of an ACO. Then what's a PCMH? Basically, it's a patient-centered medical home is a team-based model of care led by a personal physician who provides continuous and coordinated care throughout a patient's lifetime to maximize health outcomes. Now, let's look at the growth of these 2 models. In early 2010, it was non-existent, didn't even exist. Now there's 488 ACOs, which I think is a little low because I heard a figure that was more around 600. And, that's a lot. So are these models a flash in the pan? Well, based on these growth curves, not by a long shot. This is the growth pattern of patient-centered medical homes. There's 27,000 clinicians involved in patient-centered medical homes with over 5,700 sites. In December, there were none. December of '08, there were none. Need more evidence? This is the physician's employment record trends. There's been a sharp decline in independent doctors since 2000. Many of them are consolidating into ACOs and patient-centered medical homes and large hospital groups. Our current payment system pays doctors and providers for simply delivering care regardless of outcome. Doctors and hospitals and other providers that deliver better care are mostly paid the same rate as those who provide poorer care. We need a reimbursement model that takes into account the quality of care delivered, not simply that it was delivered. We must incentivize the use of best practices, chronic care management tools, and information technology, i.e. EHRs. We need to promote development and use of primary care and its providers. This is pretty much how the politicians see the problem. And this is how the experts see the problem. The United States healthcare system is witnessing the birth of a new structural model, the ACO, that could forever revolutionize the way healthcare is practiced and paid for in the United States. It could mark the beginning of the end for fee-for-service, and it could make practicing medicine without electronic tools practically impossible. This is Hal Sadaway. He's a doctor. He's the president of the Premier Healthcare Advisors. Two takeaways on this. One, the vast majority of your patients will eventually be shuffled into these closed groups of closely working medical providers. Two, these groups will not be paid solely or at all by a fee-for-service, but instead by outcomes. Let's think about this. What happens if you're not in that group? Well, some will say, but we're optometrists. We have nothing to worry about. They'll just let us in, right? I wouldn't be so sure. How much does the medical community care about optometry? Not much. This was said by Dr. Richard Holm. He's the National Optometric Director of WellPoint, which owns Blue Cross Blue Shield and has 80 million US lives. The medical community at large, despite our best efforts to become primary eye care physicians, is confused by the onslaught of revolting advertisements put out by corporate chains, opticians, and sadly some of our colleagues. They mainly regard us as mere glasses pushers, and really, who can blame them? The state of independent optometry. According to the Magic 8 Ball, outlook not so good. Exam fees are being squeezed on both sides. Affordable Care Act will likely reduce how much we get paid. Vertically integrated companies like VSP and iMed will lower exam fees by controlling how much we get reimbursed for exams. For these retail companies that disguise themselves as eye care practices, most or all profit will be in materials. The exams will be used as a loss leader to sell their products. To make it worse, independent ODs are losing market share for eyewear sales in general. Material sales make up 77% of the $35 billion eye care industry. Vertically integrated companies like Luxottica and VSP make huge profits on materials because they can be more efficient with the cost of goods, making better margins and doing huge volume that an independent OD can never, ever compete with. And these things are happening already. VSP is giving higher allowances for Marchand frames, and watch out for those iMed rerouting your patients to their stores instead of your office when it comes time to renew their benefits. Here are some new threats. Specsavers, $1.7 billion company. It's 42% of the UK market. That's 4 out of every 10 opticals or eye care offices in the UK, managed to push down the optical prices by itself as much as 30 to 40% in the UK. They have plans to make a push into the US in the next few years. That's scary. This will kill many small mom and pop optical shops. And obviously the market share will increase to those online retailers, which no one's surprised about. Main takeaway here. Within the next 3 to 5 years, your income from exams and materials will be significantly less, and medical eye care cannot save you unless you're part of a bigger group like an ACO or a patient-centered medical home. If, of course, you know how to contract one, well, do you? Now you can be scared. Okay, how can an independent optometrist survive in the accountable care age? If private practice eye care providers do not innovate, optometry profession will be dominated by chain retailers. This is said by Paul Beck. He's the Calypso Global Innovation Consulting firm. There's one solution to every one of these single problems, and it's unity, UNITY. None of us is as strong as all of us. And collectively, we have discovered how to sell our own vision plan so that we all can set the fees. We know how to lower the cost of goods so we all can make more profit, and we can take back the control of our industry. For the rest of this video and more information about exactly how you can thrive in the accountable care age, visit nyipa.org and sign up for more information about becoming a member. Your practice literally depends on it. See you soon.